Then one question for you. Which is the most obese country in the world? You can type. Any country. Which is the most obese country in the world?
India.
Different answers. Any other answer? I have only two answers. No. UK, Middle East, yes. US, huh? Canada. अब बच्चे क्या? America. Okay. Who said US? Which can you? Do you know who said that? China. Yes. Fat Indian. They call us thin fat Indians. So why we are Indians? Why Indians are obese? Because we have more of we are fulfilling the category, fulfilling the criteria, diagnostic criteria to be called as a obese or overweight, because our visceral fat, our body fat content is more. So take me for example, and another colleague of mine, my age in US or UK, he may be, I am only 67 or 66 kg. So last 20 years I am like that, kg. But a colleague, a counterpart of mine, he may be 100 kg in US or UK. But if you take the body fat percentage, I am obese than this person. So that is the criteria. That's why we are most obese country in the world, Indians. The body fat content in India, because we are genetically obese people. That's why the Westerners call us thin fat Indians. Thin fat Indians. So that's why we are at more of risk. Being an Indian, being an Asian itself is a risk factor for cardiovascular disease, because we have bad genes. Our genes are bad because we have big fat cells and we have bad fat cells. We have abdominal obesity. You see anybody walking on the road, can you see anybody very flat abdomen? Even youngsters. So this was a scene 50 years back or 60 years back when we got independence. The whole world was helping India to feed the poor. The malnutrition was so much, and just before and after the independence of the malnutrition, people, the children used to just die daily. Millions and thousands of people were dying every day with malnutrition. And the big countries like America and UNICEF, WHO, they are worried about how to feed the malnourished Indian people. Now the same wise thinking people worldwide, they are fighting, they are scratching their heads how to treat obesity in India. That is the irony. Recently, they have studied in Delhi, school children in Delhi. They have studied, one group studied from about 10,000 school children in Delhi. They found that 70% of school children, less than 10th class children, are fulfilling the category of being overweight or obese. So that is the scenario. That's why Indians are more prone. This is one of the reasons. So if you allow your body fat, if you allow your overweight to continue in your adolescent and adult life, you will develop all those blood pressure, diabetes, and metabolic syndrome, which are future risk factors for cardiovascular disease. So obesity is very important, independent risk factor. Of course, diabetes, as you all know, diabetes is a risk factor for hypertension. Diabetes accelerates the atherosclerosis. We were discussing about atherosclerosis the other day. Diabetes accelerates the atherosclerosis. It will prepone the heart-related problems compared to non-diabetic people. A metabolic syndrome, as you know, metabolic syndrome is nothing but it's a cluster of all these things. And smoking is an independent risk factor. Smoking. And male, female, who are at more risk? Now, this is a question for you. You can try. Male are at more risk or females are at more risk? Male.
Post-menopausal female.
I think I'll remove this. Okay, let me draw the graph. This is male and this is the age. Twenty, 30, 40, 50, 60, 70, 80. Okay, as you age, the risk of your heart-related diseases, they keep on increasing because of the aging population. Aging population develop atherosclerosis. You know that. So this is the male graph. It goes on increasing as your age is increasing. So that is the risk of cardiovascular diseases of males. Females, just see what is happening to the female. Female, the risk is low. Say, for example, this is one particular percentage of risk. So this is the female. Female have low risk. Again, the risk increases when they are aging. When they reach 50, this is a crucial point. 45 or 50. Somebody said menopause. Yes, men still they are menopause. They are blessed with their female hormones, which are cardioprotective. The female hormones are cardioprotective. Therefore, from 40 to 45, the risk of cardiovascular disease in female is less. But when the benefit is taken away, the benefit of the female hormones are taken away when they attain the menopause, the risk starts reaching the male state. Again, when they're crossing 70, they overtake males. So that is the curve. Hope you understood. This was the understanding in the past, the last 3-4 decades. But now, what is happening, the latest is, and this graph, which was very popular till 5-10 years back, was very reasonably understood by everyone. But now, as the new results and new statistics are pouring in, now we are understanding that females are